Hello, this is Dr. David Green, CEO of the Florida Pain Network. Today's topic is how to non-operatively treat sciatica. Sciatica is pain that occurs in a person's leg due to a pinched nerve. Usually it's from a herniated disc. The sciatic nerve is actually a conglomeration of three nerve roots that come together after leaving the spine. You can see here L4, L5, and S1. They leave the spine, then they come together to form the sciatic nerve, and they come down the back of the leg. If one of these nerve roots gets pinched as it leaves the spine, it causes sciatica with resulting symptoms that are associated with that particular nerve root. At any one point in time, about 1% of the population suffers from sciatica. The symptoms are going to depend on which nerve root is being pinched. Usually it's a herniated disc between L4, L5, or L5, S1, and most commonly it will therefore affect the L5 nerve root or the S1 nerve root. The nerve being pinched does not in and of itself cause pain. It can cause weakness, but it's usually the inflammation that gets sparked up from that leads to the sciatica pain. And it may be a burning or a searing pain or a tingling sensation, pins and needles sensation, possibly some cramping, numbness, and even some weakness. How is it diagnosed? Well, usually it's a combination of history and physical exam or an MRI or possibly a nerve conduction study. This test is actually called a straight leg raise test. When you lift up the leg on the affected side, it pulls tension on the nerve roots, and it will cause increased pain if there's a herniated disc with sciatica. And then when you bend the knee, it relieves that tension and relieves the pain. So that's very indicative. Here's an MRI showing a very large herniated disc right here. Okay, so an MRI is a really good test. And if neither of those are, super helpful, then a nerve conduction study can help. Now here's the dermatomes. Most L4-5 disc herniations will pinch on the L5 nerve root, and the L5 nerve root supplies sensation kind of coming down the front of the calf, okay, and the outside of the thigh. L4 would be on the front, coming down the front of the knee and the inside of the calf. Not every patient walks out of a textbook. If you have an L5-S1 and it's pinching on the S1, then it's usually pain that goes right down the back of the leg. It may be that you have no pain up here and you have pain in the back of the calf. So, it's kind of an individualized kind of a thing. Now, if you have muscle weakness, which can happen, it is more concerning. We don't know if you watch it for months and months and then you have a surgery, if it's ever going to get better. So you have to be very careful with how long you watch it before you end up doing surgery. And it may be a problem with knee flexion or, ankle eversion or inversion. Just depends on which nerve root is being pinched. Non-operative treatments, there are quite a few of them. Medications may include over-the-counter, anti-inflammatories, and Tylenol. A Medrol dose pack, which is a short-term burst of steroids by mouth. Narcotic medication can help. Muscle relaxers. Neuropathic medications, such as Neurontin or Lyrica, can be beneficial. And then topicals, such as prescription pain creams or patches. Physical therapy can be very beneficial along with chiropractic treatment. The treatment you see here is called spinal decompression therapy, which involves intermittent computerized spinal traction. Interventional treatments may consist of trigger point injections, which are subcutaneous injections into the muscle, and that can relieve muscle spasms and aching. Epidural injections, this is an epidural injection where the needle goes around the spinal nerve root exactly where it's getting pinched. See the the disc here pinching on the nerve? It bathes it with soothing anti-inflammatory steroid medication. This can be done as a series every couple weeks. For 6 weeks, you can do 3 of them. And then you can repeat that every few months. It's not a fix. It doesn't cure the problem, but it can put a big Band-Aid over it until this piece of disc can disintegrate. And your body knows it's not supposed to be there, so it can disintegrate. And that has anywhere from a 75 to 90% effectiveness for pain relief. Now, what are the outcomes? 80% recover within 6 weeks, 90% recover within 6 months. Studies have shown that the outcomes at 1 year are identical between operative and non-operative treatment. That was a landmark study in the Journal of the American Medical Association. Symptoms to watch out for: if you have progressive muscle weakness, that's often a relative indication for surgery. Incontinence is an emergency, and if the symptoms are getting worse, that's oftentimes better to have surgery. The top non-operative pain management in Florida is through the Florida Pain Network. There are many clinics throughout the state participating, accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. For the Tampa area, visit us online today at painmanagementtampa.com and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Green with the Florida Pain Network. Your pain stops here.